Tuberculosis is an infection of the lungs caused by a bacteria named Mycobacterium tuberculosis. It is a contagious bacteria that begins in the lung and can spread rapidly via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, central nervous system, the liver or the heart. Mycobacterium tuberculosis is a gram-positive and obligate pathogenic bacteria. It has a tough cell wall made up of thick lipid composed of mycolic acids. Slow generation time is also one of the characteristics that contribute to its pathogenesis. Tuberculosis, which you will see abbreviated as TB, is one of the deadliest diseases in the world, but thankfully in Malaysia, this disease has been largely eradicated. However, TB has been making headlines in recent years, bringing with it fears that this infectious disease is making a comeback in our shores. Based on WHO's global TB database comparing between 10 Asian countries, in 2016, Malaysia ranks third lowest after Singapore and Brunei, with 92 new TB cases reported per 100,000 people. This translates to approximately 29,000 new cases in Malaysia's population of 31 million. Incidence refers to the occurrence of new and recurrent cases of TB in a population over a specified period of time. Of the new cases reported in 2016, 62% are males, 38% are females. From the 18,000 new male patients, 2,000 of them are aged 14 and below, while the remaining 16,000 are above 14. As for new female patients, 2,000 are aged 14 and below as well, while the remaining bulk of 9,000 consists of age 14 and above. As for mortality, 1,590 patients died of TB last year. From this total, 290 of them are due to underlying HIV condition that speeds up the disease progression, also termed as TB and HIV co-infection. CFR is defined as the proportion of people who die from a specific disease among all diagnosed individuals over a certain period of time. TB in Malaysia has a CFR of 0.0548, which means that among 100 people diagnosed with TB, 5.48 of them will die from this disease. When someone with TB coughs, they expel little drops of saliva that may contain TB mycobacteria. These infectious droplets nuclei remain suspended in the air for up to several hours, which can then be inhaled by someone close by. TB mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. The body will detect the invasion and sends out its first line of defense. The bacteria are ingested by the macrophages but manage to survive inside. Internalization of the bacilli triggers an inflammatory response that brings other defensive cells to the area. Together, these cells form a mass of tissue called tubercle. Over time, the infected cells in the centers of these tubercle will die and release the bacteria which cause caseous necrosis. In healthy people, the infection may be stopped permanently at this point. The person will have what is called latent tuberculosis. In latent TB infection, bacteria stays inactive, causing no disease, no symptoms, and not contagious. However, in 5% case, the immune system is overwhelmed, the TB mycobacteria escape and the person falls ill. This often happens with young children whose immune system are not fully developed. Tuberculosis is contagious when it is in active form. It can be transmitted through airborne pathway. In other cases, latent TB can wake up and become active TB. This can happen months later or even years later, especially in adults with weak immune system. For example, people who are HIV positive, or you have had organ transplant, or who are undergoing chemotherapy. So, what happens when someone has active TB? Let's imagine the infection happens in the lungs. The patient starts coughing, has difficulty breathing, and suffers from chest pains. These symptoms last for more than a few weeks and are accompanied by fever, night sweats, and weight loss. The next stage is diagnosis. There are several TB tests available nowadays. Chest X-ray can be used to diagnose active TB. An abnormal shadow may be visible on a chest X-ray. Usually, acute pulmonary TB can be easily seen. However, it is not specific. A normal chest X-ray cannot exclude extrapulmonary TB. Skin test is a widely used test for diagnosing TB, and it is less expensive. Tuberculin is injected under the skin at the lower part of the arm. The patient must return after 2 to 3 days to look for induration site, a raised heart area. The size of the reaction is then measured, and general area of redness is not included. The larger the size of the reaction, the greater the likelihood of being infected with TB. However, prior BCG vaccination may cause false positive result in this test. Although common TB tests have been widely used currently, but some of the tests require a long time to obtain a result, and some are not accurate in TB diagnosis. The TB tests either have low sensitivity or low specificity. This may result in false negative or false positive results. Therefore, more reliable methods are suggested, including culture tests, IgRA, fluorescent microscopy, gene expert tests, and TrueNet tests. As mentioned before, TB is a preventable disease. Thus, it is important to follow the general guidelines in order to keep you and your family members healthy and safe. Firstly, healthcare providers should try to identify people infected with TB as early as possible, before they have developed active form of TB. In hospitals, people with TB should be isolated in special rooms with controlled ventilation and airflow until they can no longer spread TB. Moreover, infants should receive a vaccine called BCG to prevent tuberculosis. And lastly, reducing exposure when a person is infectious. The most important thing is always cover your mouth when you cough or sneeze, and practice good personal hygiene. Although completely eliminating the risk of TB transmission may be impossible, but adhering to these steps might be able to minimize the risk of being infected. Several drugs were developed to cure latent TB. Isoniazid is the most common antibiotic used to treat latent TB with daily consumption for up to 9 months. As for rifampin, daily consumption for up to 4 months is required. Isoniazid can also be combined with rifampicin to be taken weekly for up to 3 months. For active TB, a number of antibiotics need to be taken for 6 to 9 months long. Despite the advancement in medical technology, TB still remains as the top infectious killers in 2016. Most deaths can be prevented with early diagnosis and proper treatment, but there are still large gaps between detection and treatment. Therefore, WHO has made 24 March as World TB Day to raise awareness about the burden of TB worldwide and the status of TB prevention and care efforts. TB is expected to be ended epidemically by 2035 as reported by WHO.